Hey everybody, welcome back to Sip and Share with me, the Sweet Physique. So, on our last video, we discussed preeclampsia, what it was, what to look out for, what ramifications it could have on the mother and the baby if they are inflicted by this, statistics, and just a whole bunch of other things to kind of get a well-rounded picture of what to expect with this diagnosis. Also, too, in the last video, I did touch on how being diagnosed with preeclampsia can open the mother up to a few specific other medical conditions like HELLP syndrome and eclampsia. So today we're going to talk about eclampsia, what that is, and kind of what to expect moving forward. So eclampsia is essentially a severe form of preeclampsia. We introduced the concept and the complication of seizures. So a mother being diagnosed with preeclampsia, like I said, opens herself up to potentially developing eclampsia. With eclampsia, the pregnant woman can have seizures during her pregnancy, right at birth, or right after she gives birth. So definitely the whole time period needs to be looked at cautiously just to make sure that everything is okay with the mother. So according to the NIH, about 10% of pregnancies in the United States are complicated with eclampsia. So that statistic obviously is way smaller than the preeclampsia statistics we talked about before. However, this medical condition is still super dangerous. It's still super important that we look out for it, and definitely is one to not be diminished or kind of swept under the rug. It's very, very, very dangerous and serious. So we're going to jump right into what is a seizure. So I'm pretty sure a lot of you guys have seen the Hallmark seizure out there that, they portray on TV. Maybe you have seen it in person, but usually whenever you hear of a seizure, the number one thing that people associate with it is how the body is jerking back and forth uncontrollably. Yes, that is a very common sign of a seizure, but I just want to kind of get into what a seizure is and kind of expose you guys to other things to look out for, because that's not always how a seizure presents itself. So with a seizure, we're talking about brain activity here. We're talking about neurology, which is the official hospital lingo of what we're looking at here when we're talking about a seizure. So in the brain, there's always electrical firing going on in the brain. So when there's a seizure, the electrical activity in the brain is off balance. There's something abnormal about it, and it's causing the body to act differently. So when you have the abnormal electrical activity going on in the brain, there's changes in behavior, mentation, and consciousness. So with that going on, when somebody has a seizure, you can see changes in behavior, which can be categorized as the body uncontrollably jerking around. And in that case, you need to make sure the patient's or your loved one's, head is safe and is not able to hit anything hard during those activities. Sometimes a patient or a loved one during a seizure can be talking to you, regular conversation, and all of a sudden stare off. And then it's like a snap of a finger, they focused again. Now, sometimes right after the episode, speech may be delayed, a little off, where it's not quite making sense. They're asking you what just happened. But a blank stare like that randomly can definitely indicate a seizure just occurred. Another thing to look out for is loss of consciousness. During a seizure, sometimes you can lose consciousness where real sternal rub you, you can be pinched, we could play in your face, and you're not flinching. You're just laying there. You literally have lost consciousness. You just have a lot of things to kind of look out for with seizures, in addition to just the typical jerking around. These seizures in the pregnant woman often come on very suddenly, and can be very detrimental to the health of the mother and or the baby. Um, that is why just knowing the signs and symptoms and what to look out for is just very critical, and it can be very time saving. Signs and symptoms to look out for eclampsia is the right-sided abdominal pain. So we say right upper quadrant pain because it's on the abdomen on the right side and the upper part of the right side of the abdomen. Other things to look out for are visual changes, um, headaches, especially ones that persist and that feel like this is like the worst headache of your life could be a symptom of that. And then also mental changes. So if your cognition is starting to get a little fuzzy, you may be forgetting things that you just know you wouldn't forget. Those are all things that an impending seizure could, be indicating. Also, too, this kind of goes into just some more medical lingo. People have what they call an aura. So a lot of people that manage seizures their entire life, sometimes some of them actually know when they're about to happen. They just get this feeling that only happens when a seizure is about to occur. Sometimes it is that headache. I've had people tell me like twitching in one arm. I've had people just tell me different things that occur when they know they're about to have a seizure. Sometimes it's like a visual change. And then they'll tell me, I'm about to have a seizure. I feel like I'm about to have a seizure. And then sometimes 30 seconds later, maybe a minute later, they are actively in a seizure. And these are kind of like those aura things to look out for, especially if you don't have a history of seizures. Anything that's just off, let a healthcare provider know so that we can start looking at you way, way, way more frequently, because we just want to prevent anything or be right there when it happens. So with these signs and symptoms, our biggest goal is just to hopefully prevent a seizure from occurring, and or B, just be right there so that when it happens, we can manage it medically appropriately. When we are talking about seizures, especially before the baby has been delivered, we do need to look at to see, what the best possible option is for mother and baby to survive. With that being said, the medical team, collaborates to come up with the best possible plan, and then the term viability comes into play. And essentially what that is discussing is the fetus at a point in its development where it can survive, or not just survive, have a fighting chance of surviving outside of the mother's womb. Because there's no guarantee that a fetus at any point can survive outside of the mother's womb if it hasn't reached its full developmental stages. So this is always at a doctor's discretion. There's no hard, fast rule about this, but generally, typically at the 24-week mark, they deem a fetus having the chance to fight and survive outside of the mother's womb. So if you're at that point in your pregnancy and you are inflicted with eclampsia, there are definitely some discussions that your care team is going to be having with you, because we want you as the mother and your unborn child to have the best possible chance of both surviving in this world. And eclampsia, unfortunately, is not on the agenda for you to have to go through if you don't have to during your pregnancy. I know these are very scary things to discuss. Nobody wants to hear about early delivery of their baby. Nobody wants to hear about potential maternal and or fetal death, but these conditions are serious, and we just want you guys to know the severity of it and really just understand why knowing what's going on, these signs and symptoms, and what to look out for can really, really not only just educate you and possibly give you peace of mind, but also maybe save a life, maybe save 2 lives. It just kind of gives you more to look out for. So with that being said, I really hope that you guys found this video very educational and very eye-opening, and just kind of bringing things to self-awareness. I wanted you guys to kind of know what to look out for with this diagnosis, and just kind of what your team is looking for, the things that they are discussing, so you're kind of in the loop, even if they're not able to directly discuss things with you at the moment. Definitely more topics coming soon. The next one we're going to talk about is HELP syndrome, which is, like I said, another diagnosis that comes with potentially being diagnosed with preeclampsia. So definitely more knowledge to come. Thanks for tuning in. Love y'all.